Hi guys, in today class we are going to discuss about the most interesting topic which is a nerve stimulator. We also used to call it as TENS. That is TENS is nothing but it is a transcutaneous electrical nerve stimulator. So here I have mentioned right. So the transcutaneous electrical nerve stimulator. So what does it really do in the sense? As name itself, you can easily guess it. The transcutaneous electrical nerve stimulator is something. It's a device. It's going to stimulate your nerve by means of applying some electrical current or electrical impulse. As a result, it's going to relieve your pain. Okay, so this is the main usage of this particular device. So since we are going to apply this device just over the surface of the skin, it is can be considered as one of the non-destructive and non-invasive method, and it acts as a most effective way of pain reliever. Okay, so what is the main main backbone of this device means the electrical impulse. Yes, just by using this electrical impulse, by applying this electrical impulse, we are going to block the pathway of the pain to reach the brain, so that the brain will not feel the pain. Okay, so in this way we are getting like a pain relief. Okay, so usually what will happen in the sense when we have usually in our body we have so many receptors. We have thermoreceptors, chemoreceptors, and so on, but mainly the receptor is meant for pain is nociceptors, NOCI nociceptors. These receptors, what is the main role of these receptors in the sense it will sense a pain if the it will match with their threshold level. If it is over or beyond this threshold level, this particular receptors will send the signals to the brain, so that the brain will have the feel of a weight, and the brain will receive the particular information from the nociceptor and will do they will do the function accordingly. So once the information, the message reach the brain, immediately we will have the feel of paining. Okay, so we have the sensation feel of getting pain. Okay, so what we can we do by just to not to reach the pain signal to the brain means we have to anyway block that pathway, so that the nociceptors sending signal will not reach the brain. So that way we can have the role of having pain relief. Okay, so this is what here we are going to do by means of nerve stimulator. The nerve stimulator, what will supposed to do in the sense, by sending the electrical impulse, it going to block the pathway of pain transmissions. That way we will prevent the reaching of the pain signal to the brain, so that the brain will not have the will not give the return back information of feeling the pain. Okay, so this is the main principle of nerve stimulator. So now we will come to the components. What is the main block of the components which is needed in the TENS in the sense. So as I told you before, the main aim of this nerve stimulator is sending electrical impulse, right? So then what is needed first and foremost in the sense, that is a pulse generator. Here I have mentioned there is a pulse generator. That is a battery operator. Since it is a small handy device, we don't need to look over the main supply to reach to supply or function each and every time. So if it is battery operated means we can easily move, it's a handy and we can take it wherever we want to go or use it. Okay, so that's why it is here we have components like battery operator, pulse generator. So these pulse generator, what it will do, it will generate the pulse as our need. Okay, that is electrical pulse. So once the pulse has been generated, what next thing it is needed in the sense, leads, because that is something which is needed to carry this impulse to reach the targeted area. So what can we use in the sense, the leads is a kind of wire. Say these wire will carry the impulse, that is a required electrical impulse, all the way from the device to the particular targeted area. Then and the most important thing, but not last but not least, that is the electrodes. So electrodes. So through these electrodes, we will transmit the electrical impulse to the skin. So this is the three major components of nerve stimulators. One is the pulse generator, second one is leads, and third one is electrodes. So if we have the combination of all these three components in the sense, we can easily fabricate a nerve stimulator. Okay. Next, we will see what is the principle which is behind to control the pain in is that is a pain control theory. Okay, so I'm telling I'm telling as of now we are going to control the pain, we are going to block the pain signal, right? So what is the mechanism which is really happening, that is we should understand, right? So that is we are going to see now, that is a two pain control theory. By means of these two theory we can easily control the pain reach, and that is the pain signal. We can prevent the pain signal reaching the brain. So that is the all about this pain control theory. In our body we have a two control theory, that is one is gate control theory, another one is endorphin relax theory. So what we'll do in the gate control theory in the sense, so gate here is it's not it's like our normal gate. We just open and open. We will to get inside and get outside. What we need to do, we have to open the gate and close the gate, right? Similarly, we also have here in the spinal cord there is one segment where the gate mechanism usually happen. Through this gate opening and closing only, the pain signal will travel from in and out. Okay, so here what we are doing means, in a gate control theory, that particular segment where the gate mechanism is happening in the spinal cord, we are stimulating that segment by means of electric current. That way it will remains closed even the signal is arising over the spinal cord. So since it is closed, the pain signal will not have any way, it is not left over any way to reach the brain, so thereby it is blocking over there. So what has happened, ultimately the pain signal is not reaching the brain, so the brain will not reactive to that instruction. As a result, the what we will have no sensation of pain feel. Okay, so this is all about gate control range. By sending the electrical impulse, we are blocking the particular segment of where the gate mechanism has happening in the spinal cord, so thereby the pain signal doesn't find any way to travel over the gate which is there. So the pain signal is not reaching the brain, so thereby brain also is not reactive to that pain signal, so we not at the end we will not have any feel of pain. Next is endorphin release theory. The endorphin is the substance which is naturally produced in the body. What we are doing in the sense here, in the endorphin releasing theory, we are just stimulating that substance. We are going to stimulate the production of that particular substance more in the body. So when we have the production of this substance more in the body, we will have the feeling of happy hormone. So that what will do, this hormone will block the pain messages, this pain instruction, or the pain messages, or whatever it's called. We will block this particular signal from reaching the brain. That is the main aim of having this theories, that is endorphin release theory. So once again repeating, endorphin release theory, again here we are stimulating the production of endorphin like substance in the body. So how we are stimulating? By means of applying the electrical impulse, thereby increasing production of endorphin and or enkephalins substance in the body. We were blocking the particular messages, that is the brain messages reaching the brain. So this is the endorphin release. These are the two main pain control theory which is there in our body to control the pain from reaching the brain. So next we will see the types of current waveforms. So what are the two types of current waveform which is widely used in case of nerve stimulator, in the sense, one is square waveform, another one is spike waveforms, and in on right side I have given the parameters with their specification, what are the parameters we have to fixed when we are using the nerve stimulator. Okay, so this is all about what is nerve stimulator and what is the main components which is required when we want to design nerve stimulator, what is the application, and what is the main two pain control theory which is there in our body in order to control the pain from reaching the brain. Okay, thank you guys.